So we're going to be doing the Clark sign test, and the purpose is to test for femoral dysfunction. So first we're going to want to have the patient lie supine with their knee flexed about 20 to 30 degrees because we're going to be pushing down. So what we're going to want to do is we're going to want to slide just superior to the proximal pole of the patella, and we're going to want to push down. And you're gonna want to ask the patient to contract the muscle, and you're gonna want to ask them to do it multiple times. So, any pain? A positive test is when the patient has retropatellar pain or cannot hold the contraction. We're going to be doing the patellar grind and glide test. So first we're going to start off with the patellar grind test. So this test for patellofemoral syndrome. So we're going to want to have our patient lie supine with the knee extended and relaxed. Then we're going to want to put both thumbs into the patella and push into the trochlear groove of the femur. So you're just going to want to kind of move it around a little. And the positive test is pain. So something similar for the glide test. This actually tests for patella dislocation. So again, you want the patient to lie supine with the knee flexed 30 degrees, 30 degrees, and then relax thighs. Then you're gonna wanna have both hands press on the medial side of the patella to exert lateral pressure. So it's like this. Okay. And a positive test is when the patient can be surprised by the lateral displacement or feel uncomfortable as the patella reaches point of maximal lateral displacement. Hi, we are going to be doing the Atlas compression test, and this is to see if there's a tear of the medial or lateral meniscus. So you're going to want the patient to lie prone with the knee flexed 90 degrees. And then the practitioner should be off to the side with both hands on the plantar aspect of the foot and heel. So now we're going to want to medially and laterally rotate the tibia while applying an axial load throughout the tibia. Then we're going to want to do the same thing except applying a distraction force. So lift it up and medially and laterally rotate the tibia. Positive test is pain, clicking, or restriction.
Okay, so I will be doing the Lockman drawer test, and the purpose is to test the ACL of the knee, and the patient position is supine with her knee flexed 20 degrees. Practitioner position is off to the side, right hand stabilizing femur, left hand is on the tibia. And then you just want to relax their knee and then draw their tibia towards you. And so basically you go like, you pull this up and push it down like that. And a positive test is laxity.
Stress test. And this is to test for possible strain or rupture or too much laxity with lateral collateral ligament. So you're going to want to have your patient lie supine with knees extended, relaxed, and the practitioner position is sitting under calf. Okay. So then you're going to want to palpate the fibular head and lateral side just above fibular head. It should be like very ropey flesh like right here. And you're going to want to twist like this in different extensions. And then also extension. And this is to look to see positive test is a little to no or any movement when flexed.
Stress test, and it's to test medial collateral bench. Patient position is supine with knees extended and relaxed. Practitioner sits under calf, valgus to the side. So basically you just want to have their procedure
They do work.
palpate, go to medial side of condyle, find joint line, medial side, ropey feeling, and extension, deflection, slight. So basically, you just like have to take it and like push it, but like move it around.
This board is
Like that. Yeah. Okay, now we'll be doing the pound-so test. Purpose is to test if there are meniscal lesions at the knee. Patient position is supine, and then practitioner position is to the side with cranial hand on inferior proximal thigh, grasping foot. And the procedure is just knee flex slightly and passively extending using cranial hand multiple times. And so you just basically take it, just bend it. And a positive test is the lack of full extension. The knee position test, and it's to test the ACL laxity of the knee. And the patient position is supine with their knee extended. And practitioners is off to the side. And so you basically hand on the joint line, valgus force, ease into flexion and back to extension. And so you want your fingers right here so you can feel the movement, and then you just go like that. And a positive test is clunk of the knee when flexed 30 to 40 degrees. But we don't have that, so yeah! So now we'll be doing the reverse pivot shift, and so it's all the same except for now you're gonna just bring it back like that. And positive test is crepitus.
Okay, today I'll be showing you the Godfrey's posterior side test. The purpose of this test is to find a posterior displacement in the tibial tuberosity or a tear in the posterior cruciate ligament. The patient is laying supine. Practitioner is standing to the side. So you're going to grab the ankles and bring the hips to 90-degree flexion, and then you're going to ask your patient to flex for you. Okay, and then you're going to check the tuberosity. And a positive test is when posterior displacement of the tibial tuberosity is greater in one leg than the other. Okay, today I'm going to be showing you how to do the anterior drawer test. The purpose of this test is to determine an ACL tear. As you can see, the patient is laying supine. The practitioner is actually going to sit on the foot to stabilize. And you're going to put your thumbs around the joint line, which is about right here at the line of tibial plateau. And then the fingers on the gastrocnemius to the bone, multiple quick joints, anterior direction first. So, just gonna do like 5 of these. And then posterior is to determine a PCL tear, a posterior cruciate ligament tear. Same thing, thumbs come into the joint line of the tibial plateau, the fingers on the gastrocnemius, and then multiple quick joints, but in the posterior directions, they're going inward about 5 times. And then positive test is subluxation or movement. Okay, today I'm going to be showing you how to do the McMurray's test. So the purpose of this test is to test the medial meniscus and lateral meniscus for any tears. The patient position is lying supine with knee extended and relaxed. Practitioner position is standing laterally to the right or left of the knee. So right here. Procedure is, okay, so you distal hand grasps the heel, proximal hand on the knee joint line, so about right here. And you're going to lift the knee, flex, and you're gonna passively externally rotate the tibia. So you're bringing it up and out.
Oh, I'm cropping all of this.
And then internally, you're gonna rotate the tibia in and out. And you're gonna hear like a click. And then the positive test is any pain, popping, clicking along the joint line.